In continuing coverage, in the heat of the pandemic, essential healthcare workers were overwhelmed with questions and changing information as they worked to keep our communities safe.
In part 2 of our series marking the 5-year anniversary of the pandemic in Michigan, TV6's Julia Seitz hears from those frontline health workers. She tells us what it was like in the early days of the pandemic and how we're still feeling those repercussions half a decade later.
At the onset of the COVID-19 pandemic, many of us watched as news spread across the country of rapidly filling emergency rooms and growing numbers on respirators. Each day, new information became available, and healthcare officials in Upper Michigan were trying to prepare. Among them was registered nurse and Michigan Nurses Association Marquette Chapter Union President Christina Hansen. She says waiting for the pandemic to hit the UP was scary.
Our protocols were rapidly changing because we didn't know how to treat it. And so we were just trying to keep up on all the new information. But it was really hard and traumatizing for us.
County health departments were also working to adapt to new guidance. Public Health Delta Menominee County's health officer, Mike Snyder, says the department learned new information the same way everyone else did, through press conferences. Snyder says health officers relayed rapidly changing information to people calling by phone.
Without giving the prior notification, we weren't able to prepare, so we had to interpret the information.
However, he says the department felt prepared with its communicable disease program and pandemic plan. A large part of their work was contact tracing potentially infected people.
If that was someone school-aged, it was all the classmates, all those folks that rode the bus, might have been on a sports team or athletic team.
Despite the preparations, frontline nurses like Hansen were overwhelmed with the personal protective equipment shortages. She says they had to put one-time use masks into paper bags and reuse them on their next shift. She says low morale also drove nurses away from the bedside.
We were the people with them while that was happening, because their family couldn't come in. And we would hold the iPads so they could at least see them and stuff, and then sit there and hold their hand and be with them because nobody else could be.
5 years later, she says we continue to see those effects as fewer nurses are willing to work in those conditions. Hansen says since the pandemic, there's an influx of verbally and physically abusive patients, which she believes is caused by an underlying anger. Many, like Hansen, continue the work to keep their patients healthy.
And I don't know if it's trauma bonding or what, but it's an amazing team that we have, and I'm very proud of them.
Hansen urges hospitals to be proactive in staff safety. She says she'll continue to provide the best care she can for her patients. Julia Seitz, TV6 News.
The search for a COVID-19 vaccine was on the minds of many people 5 years ago. Tomorrow, health experts share how the public mindset around vaccinations has changed since the pandemic.